Hi, my name is Kwampunin Tanam. Today I am going to do bed bath validation. So I am going to start with 7 steps, check physician order, introduce myself, and I identify the patients. I gather equipment, I wash my hands, I explain the procedure to the patient, and then I provide privacy. So the equipment that I need for bed bath is a new gown, washcloth, small towel, big towel, and bath blanket. And then I also need a basin, soap, and I need a glove. Okay, first I am going to prepare water. Make sure water is warm, so I am going to ask the patient to test the water if it's okay. And then I am going to wash my hand and put my gloves on. Then I come to the patients and I raise the bed up to the working height. And then I put the bed rail down on the side that I am going to work. And I am going to start with mouthwash first, and after that I am going to do the complete bed bath. So I am going to cover the patients with the bath blanket. So I will not shake the bath blanket. So I cover the top of the patients. And I'm going to remove the old blanket. Okay, and I put in the hamper. Okay. Then I'm going to remove the gown from the patient's arm. Okay, I remove both sides, and then I'm going to start from cleaning the patient's eyes with no soap. So when I clean the patient eye, I wipe one stroke from inside out, both sides. Make sure I use different different part of the washcloth, and then I rinse. And then I am going to clean the patient's forehead, face, and ear, and around the neck. So, after that, I am going to pat dry. Okay. Then I am going to move to clean patient arms. So I'm going to put the towel under the arms. Okay, make sure the patient is covered. And this time I am going to put soap on and start to clean from hands. Make sure the hand is clean, skin is intact, and then I move my way up to auxiliary, and then I'm going to rinse it and rinse the patient's skin. And then I'm going to pat dry. Okay. And I am going to do the same thing on another side for validation purpose. So I'm just gonna say it, and I'm going to move to the chest. So with the chest, I am going to cover the patient with a towel, and I remove the bath blanket down. I use the soap water again to clean patient's chest. And then I rinse. And then I pat dry. And then I keep coming to abdominal area. Okay. I take the patient gown off and put in a soy hamper. Make sure the patient is covered. Then I'm going to wash again with soap water. And then I rinse. And then pat dry. Okay. Now I'm done with the upper part. I am going to move to the lower part. So I am going to clean his legs. And again, I put towel under his legs. And I use the soap water. I start cleaning from his teeth, his feet. Work my way up to knee and thigh. Okay. And again, I rinse. Okay. And pat dry. And I do the same thing to another leg. Okay. So after that, I finish with legs. I have to make sure that water is still warm. If not, I'm going to change water. And then I am going to clean the patient back. So I will ask the patients to turn to the side. Make sure another side have the bed rail up. So I am going to clean with soap water in the back, and then I'm going to rinse. Okay. And then I also clean the buttock with the soap water from front to the back, front to back, 3 times. Then I'm going to rinse again, front to back and front to back. And then I'm going to pat dry. Okay, and then I'm going to put lotion on, and I'm going to check the patient's skin. It's good. Okay, after that I put the patient into supine position, and I am going to clean the patient perineum. Okay, I make sure that I have new warm water and soap. So again, I put the soap on and I start to clean the front part from front to back, from inside out. Okay, then I'm going to rinse again, front to back, front to back. Okay. And then I pat dry. cover the patients. And then I am going to change, put on a gown for the patients. Put the gown over the patients. Put the hand on. Make sure the IV and the site of IV is not a bit large. Okay. Do the same thing with another hand. And then I pull the bath blanket off the patients, and I put everything in the soy hamper. Make sure we not touch ourselves. Everything in the soy hamper. So, and then I make sure that the patient is in comfortable position. And after I finish put gown on the patient, I am going to make the bed, and since this is for validation, I am going to make the bed making in the next video. So after I make the bed, I make sure the patient in comfortable position, the bed rail up, called belt in reach, and bed in a lower position. And then I am going to take my gloves off, and then I wash my hands, and then I document the abnormal finding on patient's skin, and that's it.